Hi, it's Christina with the Sisyphean Journal, and today we are looking at the last known victim of Dr. Emil Gleitsman. I said before, one of the most dismaying things I learned when I started looking more deeply into criminal abortion deaths was exactly how much these doctors could get away with. They were the Gosnells of their day. Now, granted, given the medical technology of the time, it could be that Gleitzman was simply extremely prolific, and when you're doing that many abortions in the days before antibiotics, you're going to start accumulating dead women. But it's still shocking how many abortion deaths Gleitzman was associated with. So we're looking at December of 1941. Marie O'Malley was a 35-year-old widow, and she was living in a really strange situation. She lived with a man named Fred Dempsey and his wife and their children, and also part of the household were her 6 children, including one that had been fathered by Dempsey. That was a tangled mess. On December 5th of 1941, Marie, Dempsey, and Marie's cousin Dorothy went to the Chicago office of 77-year-old Dr. Emil Gleitsman. Dorothy said that before taking her back to an exam room, Gleitzman had asked Marie why she was there, and she had answered pregnancy. And at some point, $50, which is a little under $1,000 in 2022, changed hands. The following evening, the 3 of them again went to Gleitzman's office, and this time Marie went into the exam room with Gleitzman, and when they emerged, Dempsey asked Gleitzman how things had gone. He replied that Marie had only been pregnant a few months. Marie said that she wasn't feeling well, but Dorothy said Gleitzman told her she'd be feeling better the next day. So Gleitzman provided instructions for Marie to follow upon her return home. She was to rest in bed for 3 to 5 days, massaging her abdominal muscles every day. She would start to experience pains on the 4th or 5th day. He also said he'd put in packing that she was to remove the following day. Now, rather than remain in bed, Marie returned to Gleitzman's office on December 7th, accompanied by Fred Dempsey. Again, Gleitzman took Marie back into the exam room, and again he provided aftercare instructions. She was to perform certain exercises such as raising her abdomen that would help expel the baby. Dempsey and Marie returned to Gleitzman's office again on December 8th. Dempsey said that Gleitzman lamented that Marie was having to submit to an abortion when she didn't want a baby, and said that in 2 weeks he'd be able to fix her so she'd never get pregnant again. Of course, we already know the outcome is he definitely fixed her so she'd never get pregnant again. Now, on December 9th, Dorothy again joined Dempsey and Marie in the trip to Gleitzman's office, and this was a grueling visit. Gleitzman took Marie into a back treatment room where she lay on a cot. From time to time, Dempsey would go into the room where he observed Gleitzman rubbing Marie's back while she cried out in pain. Dempsey asked what the problem was, and he said Gleitzman told him that the procedure was like childbirth and Marie would have to expel everything that was in her womb. Dempsey said that the bed was all bloody and that Gleitzman kept reaching into Marie's body and pulling out chunks of matter with his bare hand. Gleitzman also had a metal instrument that he told Dempsey he'd be using to scrape Marie out so infection wouldn't set in. Gleitzman wrapped all the tissue he'd extracted in paper and threw it away. At around 9 p.m., Gleitzman assured Dorothy that her cousin would be well cared for and sent her home. At around 11 o'clock, Dempsey suggested taking Marie to a hospital, but Gleitzman recommended against this, saying that this would just lead to Marie developing blood poisoning. So, excuse me, at about 4 o'clock on the morning of December 10th, Dempsey went home to look after his children. He returned at around 8 a.m., and Marie was still lying on the cot, and she asked Dempsey to take her home. Dempsey said that he preferred bringing Marie to a hospital, but Gleitzman assured him that the afterbirth had come out, so Marie would be fine in a day or two, and he gave Dempsey a blood builder to dose Marie with and sent the 2 of them home. Now, after he got Marie home, Dempsey called in 2 other doctors. I don't know the first doctor's name, but a Dr. Lerner arrived at around 10 o'clock that morning, shortly before Marie died. Gleitzman arrived shortly after Marie's death, and upon being told that she was dead, he said he didn't understand how that could have happened, and he said he'd signed the death certificate. Dr. Lerner said he was going to report the death to the coroner. Dr. Samuel Levinson performed an autopsy and concluded that Marie had died from an infection caused by an abortion. So that day, the day of Marie's death, police spoke to Gleitzman. He told them that he practiced therapeutics, which consisted of using light, electricity, and massage. He said that when Marie had come to his practice, she'd said nothing about pregnancy, although she had said she didn't want any more children. He said they didn't discuss her sex life or the possibility that she might become pregnant. Gleitzman agreed. Bat Dempsey had accompanied Marie every time she'd visited him. Now, in the first examination, Gleitzman said he noticed an inflammation around the cervix together with an infected exudate. The cervix itself was congested and bluish in color. He said that there was a tender mass in Marie's abdomen that was hard to the touch and ended under the navel. He said he concluded that Marie had cancer, and he denied putting anything, gauze, instruments, hands, into her uterus. When she'd returned on December 9th, Gleitzman said, Marie had pains all over her body and was discharging a tar-like substance, which he took to be decomposed blood from where a fetus was decomposing in her uterus. He said even at that point they didn't discuss pregnancy or even the possibility of pregnancy. He said that Marie appeared to be in much improved condition by 8 o'clock in the morning of December 10th. He said he judged from the tarry substance coming from Marie's womb that the fetus had been dead for 2 or 3 weeks, and it could not have decomposed that to that degree in just a few days he'd been treating her. And he admitted that he had indeed discouraged Dempsey from taking Marie to a hospital, but said that this was because he could provide her with superior care. Now, Gleitzman had a long history of criminal abortion dating back to 1927 when he was implicated in the November 30th abortion death of 22-year-old homemaker Lucille Van Eiderstein. Gleitzman was indicted for felony murder in Lucille's death, but the case never came to fruition. He was prosecuted but acquitted in the December 12, 1930 death of Jeanette Redder. After his acquittal for Jeanette's death, he was indicted for the February 16, 1931 death of 25-year-old Matilda Cornelius. He was convicted 3 times on a single charge of manslaughter by abortion for the March 25, 1933 death of Mary Colbert, but each time his lawyer got a reversal and eventually the prosecutors gave up. He was implicated again in the June 8, 1934 death of 26-year-old Elsie Quall. So this guy was a rather prolific abortionist. Now, when court came, he told a different story from what he had told the police during the original investigation. He said the first time he'd seen Marie, she told him she'd stopped menstruating and felt unwell, and that when he examined her, there was a foul-smelling pus running from her vagina. He concluded that Marie had peritonitis and blood poisoning and assured her that he could treat her. And over the ensuing days, he said he treated her with electric heat and vibrations. He cleaned her out on December 6th and 7th. He packed her uterus on the 7th and removed the packing on the 8th and again cleaned her out. He admitted to keeping Marie overnight from December 7th because she was in a lot of pain and having trouble breathing. But, he said, she'd been able to walk to the car when she left the office on the 10th, and he adamantly denied performing an abortion and said that Marie had never even requested that he perform one. Now, during the trial, 2 women testified that Gleitzman had perpetrated abortions on them in 1941 and 1942, respectively, and the treatment they described was similar to what Fred Dempsey and Dorothy Salveson described happened with Marie. And Gleitzman insisted he hadn't performed abortions on either woman. And he said that the reason he didn't wear gloves during examinations was that they were to protect the doctor, not the patient, and he needed to have his sense of touch unimpeded. The jury deliberated a mere 20 minutes before convicting Gleitzman of murder by abortion. He was sentenced to 1 to 14 years. He appealed but lost. And he had 2 other indictments, one for murder by abortion and another just for abortion, pending at the time of his sentence. I don't know what happened with those cases. He was still in prison at the age of 84 when the 1950 census came around. He died February 20th of 1956. So keep following. I'm going to keep looking into this character.